Hi, welcome back to Life with Hospice. Today I want to talk to you about the myths that people believe about hospice. It's incredible the difference in beliefs when people hear the word hospice and what they think that it means. Sometimes if you say the word hospice, people will say that sometimes it's the best service that they've ever received for their family member. And then some people think, oh, hospice, oh my gosh, how could you ever do that? As a hospice nurse, we hear that all the time. How could you do hospice? They assume that everything with hospice is just gloom and doom and death and dying, and it's really not. There's so much more to it that people really just don't understand. I want to talk about 4 of the very common myths that I have found in my 5 years doing hospice that people think when they hear that word, the things that just are not even true. Number 1, hospice is a service that kills you. Absolutely not true. I have a story of a patient that I had many years ago. He was in his early 60s. I get to his house, and part of that first visit is getting to know your patient, going through medications. There's a lot to it, and we'll go over some of that in later episodes. But I get there and we're getting to know each other, and he says to me, so when are you going to do it? And I looked at him and I'm like, when am I going to do what? And he goes, it. And I looked at him and I all of a sudden realized what he was talking about. He believed that I was coming to his house to kill him, to give him the medication that he needed so he could pass on. And I said to him, I said, no, sir. I said, that's not what I'm here for. I'm here to help you live. I'm not here to help you pass away. And he said, oh. And what really made me sad about the situation is that even though when somebody's being admitted into hospice, they are explained all of the ins and outs about it, what the services are going to entail. Well, when this gentleman signed this paperwork, he was signing for someone to come and end his life. And that made me very, very sad. But I explained to him the situation and that that's not what we do. That's not what hospice is. And he was good with it, and we had a good long hospice life with this gentleman, and he lived life the way that he wanted to for the rest of his life. So it all ended up okay, but it was just amazing to me that there are people out there that do believe that hospice kills you. I always tell people when they think, that hospice is kind of the end all be all, that hospice doesn't help you die. It helps you live. It helps you live the way that you want to. When you're in the medical system, you're like in their world. You have to do what they say. You have to take what they tell you to. You really don't have a lot of say in the hospital setting, what I have found out. And when you're in hospice, you can get to that point where you don't have to deal with that anymore. You live life on your terms. You get to do what you want to do. You get to take what you want to take. Like, you run the show completely. And that's something that I really, really like about hospice. If you don't want to go to the hospital anymore, you don't have to. You don't have poking and prodding anymore. You don't have medical procedures one after the other causing pain and suffering. You don't have any of that anymore. When you're in the hospital, pain control sometimes is an issue when you are to that point where you could be on hospice, but you're not. Medications aren't given readily in the hospital like they would be in the home setting. Sometimes floor nurses are a little bit nervous about giving higher doses of pain medication, even though a patient may need it. So sometimes if you're not in hospice and you're in the hospital, that you don't get the pain control that you need if you are in those later stages of life. So being in hospice affords you that ability to be able to get the pain control that you deserve, because that's what hospice is about. It's keeping you comfortable. When it comes to feeding, just another example, in the hospital, if you were to have trouble swallowing, they would make you NPO, which means you are not allowed to eat anymore. Well, in hospice care, if you sometimes at the end of life you start having trouble swallowing, well, if you do, you want an ice cream cone, you get an ice cream cone. If you want a beer, you get a beer. Like, you get what you want. In the hospital, it's not like that, because there are rules and regulations. Yes, hospice has rules and regulations too, but it's just everything is driven by you and what the hospice patient wants. I had an incident not that long ago where a young gentleman, just in his early 40s, had cancer that had spread to his whole body, and had so much pain, so much in and out of the hospital, treatment after treatment after treatment. And finally, him and his wife decided that it was time for hospice. And me and her had a really long, really good conversation about his life, about her life, about their life together. And when she walked me outside, she said, "I really wish I would have done this sooner, because I have put my husband through so much pain and suffering with treatment after treatment after treatment when nothing was helping. But they just kept going and going and going, instead of just taking him home into the surroundings that he loves with his family and his animals and his children, and just letting him be in a pain-free, relaxed environment so he could pass away, because the end was going to be the same. It's just the way they went about it was different. And unfortunately, we lost him 2 days later. So he wasn't with us very long, but the end of his life at least was more comfortable, so he could pass on peacefully. The Journal of Pain and Symptom Management reported hospice patients live actually 29 days longer than non-hospice patients who are critically ill. You would wonder why that would be, why patients in hospice care would actually live longer. They are more comfortable. They actually receive more care than somebody who goes into the hospital, goes back home, back to the hospital, back home, just on and on. In the hospice setting, when you're in your home, people come to you. They have people coming to their house. They have nurses, chaplains, social workers, aides. All of these people are coming into their homes and helping them through this time and keeping them comfortable. So in all reality, sometimes patients can live longer on hospice care than if they weren't on hospice care at the end of life. Myth number 2, morphine will kill you. This one is huge and is definitely not true. For some reason, morphine is the end-all be-all drug that kills everyone. For some reason, that is what a lot of people feel. Like, that is the bad drug. But in all reality, it's just not. And I don't know when that started, how that started, but it has been known for that for so long. First of all, I want to explain to you what morphine does. Morphine is a very good drug that helps 2 things, well, actually 3 things. 2 things with breathing, and then 1 thing with pain. Number 1, it helps with pain. We actually start with very low doses, so sometimes those doses have to go up, but it does help with pain, especially along with other narcotics, other medications. The 2 things that it helps with breathing: first of all, it helps lower your threshold for air hunger. So somebody who's having trouble breathing, like somebody with COPD, somebody with scarring of their lungs, any kind of breathing issues, it helps keep somebody from feeling like they can't breathe, for one. Number 2, it relaxes the lungs. It relaxes all the alveoli and stuff. It allows the air to come into the lungs and go out, go in, go out. If somebody is like at the end of life, sometimes we call it tachypnic. You may hear that word. If they're breathing too fast, that morphine will, because it's allowing that air to go in and go out, it lowers the breathing like a freight train. So if you're breathing 36 times a minute, that is way too fast. You give a little bit of morphine, it slows down the breathing by allowing the person to breathe more effectively so they don't have to keep breathing that fast. So it is a great, great drug for breathing. A lot of people don't realize that morphine is used for all breathing. It doesn't matter if you are in hospice care or you can't breathe, so you go to the ER and you're not a hospice patient. Morphine helps people breathe. So, but for some reason, people only believe that morphine stops you from breathing, which if somebody overdoses on morphine, absolutely that can happen. But in hospice, you are starting out with very low doses. Usually 5 milligrams is what we'll start with. It's a very low dose. It's an oral dose too, and it makes a difference whether it's oral or it's IV. Oral 5 milligrams and IV 5 milligrams, very, very different. The oral 5 milligrams is a very, very small amount compared to the 5 milligrams of an IV. And most of the time we're giving the morphine at home orally. Okay, so you ask why this misconception? I don't know. Is it movies, word of mouth? Not sure. Not sure why morphine is the killer, but it's really, really not. I have looked up some information just to let you know the difference between morphine and other drugs that you may have heard of before. Oxycodone, otherwise known as Percocet. I'm sure a lot of you have heard of that drug before. That drug is 50% stronger than morphine is. People don't realize that, but it's 50% stronger. Dilaudid, I'm sure a lot of you have heard that. Dilaudid is 5 times stronger than morphine. And then the big one, fentanyl. Fentanyl is 100 times stronger than morphine. But for some reason, people hear those other drugs, they still feel like morphine is the bad one when it comes to drugs in general. So, but it's absolutely not. It's a great drug for helping with breathing and pain. Don't be afraid of it. Myth number 3, once in hospice, you won't be treated medically anymore. Not true. Hospice patients continue to get medical care during their whole time with us in hospice. People seem to think once you come into hospice, then that's it. You pretty much just lay down and die, and it's not true at all. Hospice nurses and doctors treat for many, many different things. For example, if a hospice patient were to fall and need medical attention because they need stitches in their head or they broke an arm and they need to have it set, all of that will definitely be done with a hospice patient. If that hospice patient cannot get to the hospital, we transport them there, get the care that they need. They don't have to sign out of hospice for it. They go get what they need, come back home like it never happened. If a hospice nurse goes there and finds that the patient looks like they have a urinary tract infection or an upper respiratory infection, we do give antibiotics. For some reason, it is known out there that hospices don't treat and don't give antibiotics for anything. Not true. I've given more antibiotics to hospice patients than I've given to anyone else. So believe me, hospice patients are treated with antibiotics along with any kind of injuries that they may sustain. In hospice, the only care not given is curative treatment. Like if you have cancer, you're not going to continue to get chemotherapy to help get rid of the cancer. There are some instances where you could get palliative chemo and radiation to shrink a tumor to help with pain control. I've seen that happen before, but it's not going to be anything that's related to trying to get rid of your cancer or radiation to get rid of your cancer. But if you can shrink it for pain control, then that would be a reason to get it while you're still on hospice and not have to sign out of hospice. Another instance would be giving blood. we normally wouldn't give blood to a hospice patient, but for example, we had this gentleman who had leukemia, and he was given blood every couple weeks because his counts got so low that his energy was gone. He couldn't do all the things that he wanted to do. He was just a real young, active guy that was, working on his car and helping jump people's cars and just having a good life. And if giving him blood was going to continue that on for him, then we absolutely needed to do that. So that we did do. And then when giving that blood no longer helped, then that's when we stopped. And he eventually did pass away. But there are instances where palliative treatment will be given for comfort. Myth number 4, signing into hospice is a death sentence. Not true. People believe that when you sign into hospice, then that just means you're just going to lay down and die. And that is absolutely not true. It is true that life expectancy of a hospice patient when they sign into hospice is supposed to be 6 months or less if their diagnosis runs at the expected course. But people have been on hospice for years. There is a qualification process that every 2 to 3 months, the hospice patient's case will go up before a meeting where the doctors, the nurses, the social workers, the chaplains, everybody come together and discuss the patient every 2 to 3 months. If that patient continues to qualify, then they will stay on hospice. We have had patients on hospice for over a year. We have also had patients even longer than that. So it all just depends on the person. Everything is very individualized in hospice care. And this is something a lot of people don't realize about hospice. People are discharged from hospice services all the time. If somebody comes on to the hospice service and gets better, which does happen, it actually happens frequently, that they come on to us, it looks like they're going to die. We get them all into our service, and then they start to get better, which is wonderful, which is absolutely wonderful. And then we have to discharge them. And it's kind of funny that there are some times where people do get better and they appeal, because there's an appeal process that can happen if a hospice is discharging a patient, not because of the patient wanting it, but because of the hospice needing to do it, that they will appeal and try to not get off of hospice services because they have grown accustomed to all the services that we provide. Because if somebody has been receiving, an aide that comes in 2 to 3 times a week for bathing, and a nurse is coming in, and social workers and chaplains, and their medications are being sent to the door, people love the services, especially once they get used to being on it. And sometimes they do not want to be off of our services, even though it is a wonderful thing that they're being discharged. There is another reason, too, that people may become discharged from hospice, and that is if they stay the same. In hospice, you want patients to decline over time. I mean, you don't want them to decline, but that is what hospice is that people come on and we help them through the end of life. Well, if somebody gets to the point where they are no longer declining and they are just staying the same, which is a wonderful, wonderful thing, then we have to discharge them. So that is another reason why we would discharge them. So signing into hospice absolutely is not a death sentence, because some people get discharged and they no longer need our services. So don't think that just because somebody signs on that there's no leaving hospice. So today we've talked about 4 myths of hospice. 1, hospice is a service that kills you. Morphine will kill you. Once in hospice, you won't be treated medically anymore. And then signing into hospice is a death sentence. All 4 of these are absolutely not true. I really hope that this video has helped you with some of the misconceptions about hospice care. To continue to learn about hospice and hospice services, just subscribe to my channel. Next time, I plan to dive into what is hospice and what services do they offer. We'll see you next time.